Welcome to this explainer. Look, if you're an ambitious public health professional aiming for a senior role at the World Health Organization, the UN, or maybe a Ministry of Health, you already know the stakes are incredibly high. The technical expertise you've spent years and years building, that's your foundation. But the second you step into that interview room, the rules suddenly change. So today, we're exploring a truly groundbreaking resource designed to help you navigate this exact challenge, the Public Health Leadership Interview Simulator. It's a comprehensive premium workbook put together by physician epidemiologist Dr. Usama Wael Bufrintala.
Okay, let's dive into this, because it is a remarkably common frustration. You've got the field experience, you know the surveillance protocols inside and out, and you have the data completely committed to memory. Yet, so many highly intelligent, deeply experienced candidates walk out of panel interviews and they just don't get the offer. Why does that happen? Well, it's because they assume the panel is testing their textbook knowledge. Actually, scratch that. They aren't. They assume you already have that knowledge locked down.
The core issue here, and Dr. Bufrintala hits the nail on the head in the workbook, is that candidates fall right into the interview trap. They confuse a technical answer with a leadership answer. Basically, they describe what should happen in some ideal, perfect world according to the guidelines. But let's be real. Panels aren't looking for an ideal world. They want to see your judgment under extreme constraint and uncertainty. They're looking for how you prioritize when resources are practically non-existent, and how you lead people who don't even directly report to you.
So, to actually pass this test, you've got to understand what the panel is really grading you on. Behind every single question they throw your way, the interview panel is secretly scoring you across a specific set of core competencies. And the magic number you need to keep in mind here is exactly 5. Most candidates, even the really good ones, will casually hit maybe 1 or 2 of these competencies in their answer. But the candidates who actually get the job, they hit all 5, every single time.
Let's break down how this builds into the exact rubric panels use. These 5 critical competencies are decision-making, structured communication, leadership, crisis management, and measurable outcomes. But listen, it's not just about having them. It's about demonstrating them at a level 5. What does that mean? Well, level 5 decision-making means you act on the worst plausible diagnosis when waiting around for permission is simply too costly. Level 5 leadership means you don't just manage a crisis, you build durable institutional architecture so your influence outlasts your personal involvement. Honestly, this is the structural gap between average and exceptional.
Moving on to Section 2, the missing element, upgrading to the STAR+PH Framework. Now, what's really interesting about this slide is how we actually put this into practice. To consistently demonstrate all 5 of these competencies in the heat of an interview without sounding like a scripted robot, you need an upgraded operating system. You're probably familiar with the standard STAR method: situation, task, action, result, right? It's the most widely used behavioral framework out there. But the workbook argues that standard STAR is actually entirely insufficient for senior public health roles. It just stops way too early. So Dr. Bufrintala introduces the STAR+PH framework. That plus PH stands for public health reflection. And let me tell you, it is the ultimate game changer for senior candidates to connect their answers to massive, system-level implications.
Here is how you construct that perfect response. You start with the situation, and you keep it really brief, only about 15% of your answer. Then the task, defining your specific mandate in just a sentence or 2. Next is the action, where you sequence your moves and explicitly name the trade-offs you're making. Then comes the result, which absolutely must include measurable outcomes with specific timeframes. So the crucial point is step 5, the plus PH reflection. This is where you step back and ask the panel, what does this tell us about the health system? What structural change did I make so this never, ever happens again? This reflection is the exact moment you prove to the panel that you are a true senior-level leader.
All right, let's jump into the next part. Inside a real simulation, surviving a measles outbreak scenario.
Theory is great and all, but let's actually put this into practice inside one of the workbook's 20 flagship escalating simulations. Put yourself right in the shoes of a district medical officer. You walk into the room, and the panel drops a 90-second briefing on you that looks exactly like this. You have an active measles outbreak, 47 cases in 3 weeks. Vaccination coverage is hovering at a very dangerous 68%. 3 kids are already hospitalized. You're dealing with a deeply hesitant minority community, your vaccine cold chain has major reliability issues, and you have absolutely zero spare workforce. Go. What do you do in the first 72 hours?
Well, a weak candidate tries to do everything sequentially, or they just blurt out, "I'd start a mass vaccination campaign." But you're aiming for level 5. You have to manage parallel tracks. By hour 6, you're establishing case definitions, mapping the outbreak, and personally confirming those hospital diagnoses to protect those 3 kids. By hour 24, you're explicitly auditing that failing cold chain before you move a single vial and initiating a highly targeted ring vaccination instead of a broad, wasteful campaign. And by hour 72, you're engaging hesitant community leaders through trusted intermediaries before any campaign even reaches them, and you're issuing a structured sitrep to the regional authority.
And this brilliantly illustrates the massive difference in candidate quality. Take a look at the weak answer. It sounds totally reasonable to a novice. Activate the plan, begin the campaign. But to a senior panel, it's a total disaster. It completely ignores the cold chain risk, it ignores the hospitalized kids, and it ignores the hesitant community. The strong answer uses that STAR+PH architecture to actively sequence interventions, mitigate risks, and manage tricky stakeholders. It literally proves you can handle chaos.
But remember, we need that level 5 finish, right? Here is the ultimate aha moment, the +PH reflection. After securing the immediate crisis, you look a panel dead in the eye and say, a coverage rate of 68% was in the survey 18 months ago. This outbreak was entirely predictable. The structural question is why the data didn't trigger a proactive campaign before the outbreak. After the acute response, I would initiate a root cause review of our surveillance to action pathway. Boom. You just pivoted from being a frontline crisis responder to a massive institutional architect. That is how you get hired. Let's wrap up by talking about the premium workbook, 160 pages of masterclass preparation.
Listen, what we just walked through, that was merely round 1 of simulation 1. It is a tiny, tiny fraction of the immense value locked inside this text. If you want to stop leaving your career advancement up to chance, you really need to see the rest of this material. The full premium workbook is literally a 160-page masterclass. It features 20 flagship simulations covering everything from cholera and refugee camps and budget crises to AMR emergencies and mass casualty disasters. And because interviews naturally escalate in pressure, there are 80 fully worked escalating rounds showing weak, average, and strong answers. It includes a high-stakes question bank, a self-evaluation scoring grid to instantly diagnose your weaknesses, the 10 disqualifying red flag patterns that will end your interview on the spot, and even 5 AI mock interview prompts you can just paste into your favorite AI assistant to practice at 2 a.m.
The best part? This isn't some annoying subscription or a drip feed course. It is one comprehensive, publish-ready file that you download once and use for every single interview for the rest of your career. It's available right now on PayHip through Bow Team Publications.
So, I'm going to leave you with this final thought to consider. You've already done the grueling hard work in the field. You've earned the technical expertise. But when you sit across from that panel and they hand you a massive crisis with no easy answers, are you truly ready to show them a level 5 leader? Grab the workbook, master the STAR+PH framework, and make sure your next interview is your absolute last. Thanks for joining us for this explainer, and keep learning.